Good afternoon and welcome to Remapping Digital Strategies, Establishing Priorities in a Changing Economic Environment, a Health System CIO Media Inc. production, sponsored by Kyruus. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of Health System CIO, and I'll be your moderator today. We're hoping for some questions. If you have them, send them into us in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, we're going to go about 35-40 minutes with our main panel discussion featuring Dr. Bart, CMIO at UPMC, Joel Vengco, SVP and Chief Information and Digital Officer with Hartford Healthcare, and Scott Andrews, General Manager for Health Systems with Kyruus. So let's jump right in. Dr. Bart, let's start with you. Can you give us an overview of your organization and role?
So as a Chief Medical Information Officer here, I work predominantly on the delivery side of our organization. So UPMC is about a 50-50 split between our payer side and delivery as far as finances go. We have about 40 plus hospitals, predominantly in the state of Pennsylvania, with a small outpost in Western New York and a small outpost in Western Maryland. And then, of course, the accoutrement of all of the sort of ambulatory sites to support the acute care. We also extend into the post-acute space in traditional SNF, LTACs, as well as trying to develop innovations in in-home delivery of services. All of the clinical solutions here report into me as far as how they function and operate for UPMC.
Very good. Thank you. Joel?
Yeah, good afternoon, Anthony. Thank you for having me. So Hartford Healthcare is right now the largest health system in Connecticut. And I say right now because it's sort of a back and forth between us and another health system that shall not be named at the moment. But we are about over 450 sites across Connecticut, 10 hospitals. We had a strategy that started well before me coming on board about 5 months ago, that we wanted to be within 10 miles of every resident in Connecticut. And I'm proud to say that we're there. And of course, I opened my mouth to the CEO and I said, what if we're 0 miles? And so here we are with the digital strategy. We also have some academic affiliations with Quinnipiac University and also have residents from UConn that come over to our main hospital. We've got a number of joint ventures, including Go Health, and you may have seen One Medical recently. While they did get acquired by Amazon, we've got a partnership with them down in the southern eastern part of Connecticut. But we're continuing to grow, and I'm excited to be here with you today to talk about digital.
Thank you very much. Scott?
Thank you, Anthony. Dr. Bart, Joel, it's nice to see you both. Pleasure to be here. My name is Scott Andrews. I lead the health system team at Kyruus, which Kyruus, for those of you who may not be familiar with us, we're a leader in patient access, guidance, transparency. We work with over 100 health systems and 400 medical groups. We also work with over 100 health plan brands. To bring all of that data information together so that we can help consumers, members, patients, providers put their best foot forward and find each other as you're both looking for care and matching up care out there in the marketplace. We do that by essentially starting with creating a golden record of who the provider is, and then again, getting that data around that provider, including their availability and schedule, everywhere where somebody might be looking for care.
All right, very good, Scott. Thank you. All right, big question, but we'll jump right into it. Dr. Bart, we're going to start with you. Health systems across the country are facing IT budget cuts and are being challenged to seek out greater efficiencies. Have you been asked to cut back or reevaluate your digital initiatives? And if so, what's the criteria for determining which projects will continue, which will be deferred, and which will be eliminated? And how a follow-up is, how has your approach changed, if at all, to how you assess more foundational technology or infrastructure investment that would offer enterprise-wide benefit? Dr. Bart.
Thanks, Anthony. So I think the key word in this question is efficiency. I think we're always asked to evaluate and reevaluate sort of our impact on the overall health system budget, both in the total dollar amount as well as the percentage of the total budget. But I think that the thing that we're really being focused on right now is how are we looking at technology to improve the efficiency and effectiveness of our clinicians and our operations. That's probably been the biggest focus for calendar 2022. As I think about it, when we historically have gone and obtained a new technology or solution, we historically have, at least in my feeling, have not been as good at documenting what does that technology provide as far as value to the organization. And I think we're trying to do that much better today. And part of the reason is 3 or 4 years from now, if we're not involved, someone coming and looking at, hey, why do we pay $1 million for X on an annual basis? If we haven't documented well what the opportunity of efficiency and effectiveness that the organization has gained, that's becomes something that's easily sort of lopped off the budget. And I think we're trying to really focus on what is the value that UPMC is deriving, both for its clinicians and operations, as well as for its patients and consumers. And then making sure that that value is continued to be measured on an ongoing basis. And that's become much more of the focus of how we evaluate both our incumbent technologies as well as those solutions we're looking at right now. And efficiency has been a very, very big focus for 2022. A lot of it, as all of you know, and I'm sure our attendees know, healthcare, like all of the other industry verticals, has had significant challenge with getting a good employee base. And it's not just clinically credentialed employees like RNs and physicians, but large healthcare systems like I'm at and where Joel is require a large number of employees to support the clinical operations. And those are the ones that I think that are sort of unsung heroes. And we have to figure out how do we use technology in a more effective manner to bridge those gaps. For example, our biggest challenge is we were a very central call center mediated access for care. And the number of FTEs to support that was pretty significant. And as we've tried to recraft ourselves into a much more digital access, we've had to not only take into account, is it digital for the patient and consumer, but is the actual clinical operations also digitized so that we can actually decrease the FTE footprint because the FTEs aren't available to continue that part of our operation. So I just wanted to give you that as sort of one example of an area we're paying a lot of attention to. And there's a willingness by IT as well as our financial partners here at UPMC to invest if those solutions have that type of return on investment and create the value for UPMC. Thanks, Anthony.
Sure. And the ROI, measuring the ROI is what you're talking about when you say sort of monitoring these applications after they're purchased to see if you're getting out of them what you had hoped to get out of them.
Exactly. And I think traditionally people had looked at I think the financial ROI relative to other technology, as opposed to looking at what was the total cost of ownership and value it provides, which is something that we're paying much more attention to, meaning we're also trying to look at how it impacts the operational support and operational dollars and seeing if we can drive those further down with the right investment in technology.
Very good. Joel, your thoughts?
Yeah, I think I'd also just augment the question a little bit. I mean, I think we're all facing budget cuts just across the board in terms of all domains. So, I just came off of a conversation, as I mentioned to you earlier, talking about how do we, for this year, look at right-sizing our budgets, across all of our domains, clinical, non-clinical, IT facilities, et cetera. And yet, I think as Rob had mentioned, technology is even that much more critical for trying to figure out in these tough times how to leverage technology, how to leverage data to do your work maybe better and different. And so I think for us, it's sort of thinking about what are the fundamental things that we still need to continue to do, provide quality care, provide safe care, optimize our access imperative, and then the things that we believe are accretive to the organization, like our necessary growth and strategic initiatives. So those are that's the framework that we use to think about how we then apportion the budget to ensure we're still watering parts of the lawn, if you will, that will enable us to at the very least look like we're continuing to progress forward. And so while we have aspirations to do a number of things digitally, some things that are transformative and innovative, the question we ask is, what can we do that can, continue the way that we deliver care at the highest possible level with what we have. And so I think, Rob brought up, again, the access piece and efficiencies around access. I think that's a really great example of where, we can facilitate, different ways of providing access or different ways of allowing our patients to acquire access through self-service capabilities, through technologies that enable us, or digital capabilities that enable our access representatives to be more efficient in the way that they look for the proper physician or clinician for the specific patient. And so, when I think about digital, and to your question about, what initiatives do you cut, what initiatives do you go forward with, digital to me is not really just about, the technology in and of itself. It really isn't that. It's not about a killer app at all. It's really about, capabilities that enable you to harness the capabilities that you have across your health system. And so we are selecting digital capabilities that enable us to not only be more efficient, but be more effective in the way that we provide a service to our patients. And so as I think about like I said, 400 plus sites and numerous institutes and services that these institutes give to our patients, the question is how do we give patients a more efficient and effective way to engage with us, and for us to engage with them using these capabilities. And so those are the kinds of things that we think about as we try to assess, what do we do now, near term and short term and further in the future.
But Joel, Dr. Bart mentioned that in addition to maybe a closer eye on the budget, maybe cutting some dollars, there's also a push to say, what are you doing with what you have? The money you're currently spending, are you sure it's all being used well? So before you ask for more money, are you using what you've got? Are there applications that he mentioned? Are there licenses that have been paid for years that nobody's using? Are there applications where there's 100 bells and whistles and we're using 2?
Yeah.
So is there a push to do that as well as to maybe bring the budget down a little bit?
Yeah, for sure. So I've been in my current role 5 months, and one of the first things that I focused on was application rationalization. We have this initiative called Project One, and it's really about rationalizing the portfolio, identifying where those redundancies may be, and then selecting maybe hopefully one application that can kind of do all of those things that you've brought in 5 or 6 different applications to do. And so that's certainly one of the things that is top of mind for us is application rationalization. The other part is about optimization, to your point, and really thinking about your portfolio as a sort of with a product mindset rather than a project mindset of kind of yesterday. In the past, we were all about projects and sort of one and done, and we move on to the next because there were so many things to have to implement or deploy. But now it's really about how do you optimize the products and capabilities that you have with the product focus, so that you're evolving it continuously, making it better for your users and your customers. And so it does bring out that question of, did we eke out or squeeze as much out of that particular capability or technology that we should have and could have. And so that's where I'm focusing my applications teams now, is really on this notion of product management, with a focus of really evolving it over time, rather than just purely implementing and then moving on to the next.
Yeah, it makes me think, so if you do that, if you are able to come into any discussion and say, here's the rationalization we've done, it's tight, we're spending our dollars wisely, and oh, by the way, we need more. It's a lot better than just saying we need more, right? To demonstrate what's being done is being done properly and with thought. Scott, let's bring you in here. Dr. Bart Joel mentioned access. I know that's where you play. People coming in, interacting with the health system in a digital way, not needing as much human interaction. Obviously, you want that to be as smooth as possible. Those interactions can be good, or they cannot be good, right? We can't just make them digital and not think about it, because I think we've all been at the wrong end sometimes of an unpleasant digital encounter that didn't go anywhere. But your thoughts on what's been said?
Yeah, no, I mean, it makes a lot of sense to me. I think that everything that Kyruus does is really try to optimize both the cost equation that a health system has, as well as driving in more patient revenue. And specifically, I'll pick up on a point that Dr. Bart mentioned around centralizing the call center. I mean, we're probably never going to get to the point where every single appointment can be scheduled online, right? So what you want to make sure of is that you're finding the right balance between engaging with a human, where you need empathy, you need that voice on the other end to help reassure you that it's going to be okay and guide you through this experience that you're going through, versus something that's a little bit more, mundane and straightforward. And let's have people book those appointments in a self-service manner, because it's probably more efficient for them. They'd probably prefer to do it, considering everything else that we do in our lives, and really, again, hold out those more intricate conversations to a human being, so that you can have that service and that experience that you're looking to drive on both sides of the equation.
Yeah, that definitely sounds like the way to go. All right, next question, Joel, we're going to start with you. Thinking specifically about digital patient access initiatives, how are you reprioritizing your roadmaps? What does the process look like, and who is involved in these decisions? Which initiatives or technologies are still top priority and which have been put on the back burner? Anything further you can offer there?
Well, yeah, so one of the things that we are focusing on is the foundation, our digital foundation, and the digital foundation has a lot to do with the data that we still have yet to really harness about our patients, about our community, because this notion of consumerism and digital, and the digital patient really cannot be achieved without having information about those that you're serving. And so fundamentally, we have to put this data and digital platform together, on top of which the digital capabilities can then sit to enable what we'll call the personalization of the engagement to that patient. And so that's really sort of the first part of this. We've, over the last decade, we've put in, as many other health systems have, put in the core technologies, the Epic, the Cerner, whatever, the EHR and of course, other capabilities that collect this data. Now it's time to harness that information, a centralized platform that enables us to begin this development of what will be essentially the digital platform for our patients. And again, as I mentioned, the digital platform is really about harnessing the capacity and capabilities of our health system in a way that serves it up to the patients uniquely. Our vision at Hartford Healthcare is to be the trusted partner in personalized, coordinated care, and really the data and digital initiatives that we have, or at least we're aspiring to achieve, is going to be really central to that. The folks that are involved with these initiatives obviously are multidisciplinary, and it's really not a technology project or initiative so much as it is a business transformation and a clinical transformation story that many folks across the enterprise have to be involved in. Even the development of our foundational data and digital platform, which is in some level, a healthcare database or data foundation, those have to be informed by the use cases that the business leaders and the clinical leaders and the staff are living day to day. So we've got folks that are clinically oriented, like our chief clinical officers, those that are on the finance side who are absolutely focused on access, but also on the rev cycle components of the process, to the folks that are actually in the weeds of the day-to-day, clinical work. And so it really does span the enterprise and the business, and it requires a number of different viewpoints and lens of all of these different individuals. I would also add that, as we build this platform, one of our lenses that's critical is the equity lens. And so, we're blessed with a really amazing diversity, equity, and inclusion and belonging organization, in addition to a human-centered organization. And those two organizations allow us to do this in such a way where we're always considering, who are we leaving out? What are we missing so that we can include and involve all of those that are in the population? So I would say that that's how we focus on, building this.
Very good. Very good. Dr. Bart.
Yeah, I mean, building a bit on what Joel said, UPMC is not too significantly different in its efforts. I think as it relates to patient access, one, we've got a really enthusiastic, innovative employee group here, both clinically and operationally. And part of that is redirecting from maybe these one-off point solutions as we're trying to create a true single digital front door for UPMC into more of a platform-based solution, right? And I think that's been one of the, wonderful things that has come out of the challenge of the pandemic. Going into the pandemic, I would look at digital access as being very point-specific solutions. And then the health system like UPMC was left having to cobble these all together into an integrated sort of bundle that a consumer or patient could interact with. And I think that there's been a rapid maturity within the digital access space into different platforms that people can think about leveraging so that you can actually create a much more holistic experience for that patient or consumer. It's probably one of the reasons I might be here is with Scott is because UPMC does use Kyruus, right? And we did start off in the find a doc sort of solution space with it, but we're now moving and morphing into sort of, that's one of the platforms that we're really the platform we're using to take new consumers and convert them to a patient. If you're a new individual within our geography who's looking for a new physician, a new service, some of our ancillary services, it's more than likely, if you don't have an established relationship, that you may come in through what we put out publicly through Kyruus. We're going to leverage that as a platform of engagement to try and work towards converting that consumer into a patient. And that's one of the things I'm very excited about, is the opportunity to have more of a platform level engagement as it relates to patient access. I think the other thing that we're paying a lot more attention to is a lot of the initial foray into consumer and patient access digitally paid attention to the digital interaction of the patient or the consumer. What it didn't do, though, was pay equal attention to the digital interaction of the clinical operations. And in fact, many of the initial solutions all they did was create a work queue on the internal side. So you ended up, so if I don't have enough people to man a central call center, then I probably don't have enough people to also oversee working a bunch of queues. And I think the more mature solutions today are including robotic process automation or other tool sets, so that not only is the consumer patient experience digital, but the clinical operation experience is much more automated and much more digital. And that actually has been one of the things that we've been focusing on as we reprioritize our roadmap. Is it not only a good consumer experience that aligns with UPMC, but is it also offering a good employee experience and better automation, so we can decrease the work effort and redundancy of employee effort. And that's been a big focus for 2022 around our sort of reprioritization and focused on making things more efficient and more effective for care delivery.
Very
Thanks.
good. Very good. Scott, your thoughts?
Yeah, I mean, look, I agree with everything that Dr. Bart and Joel are highlighting. I think I'll go back to the point that Joel made around patients and understanding who the patients are. And that's where, everybody loves to talk about supply and demand, but it's not very often where you actually have the whole picture of the supply of your providers and where that demand is coming from and how that might compare to your competitors. And so knowing that you've got somebody who's looking for a neurologist, in the suburbs and doesn't want to come downtown necessarily, and being able to overlay that with where your providers are or where you want your provider network to be, I think is a really powerful component to how you better serve the patients in your community and attract them into your organization. And clearly, again, at Kyruus, we believe we help our clients to do this. And so I think that's a really important component that Joel was calling out there.
Scott, Joel mentioned equity and inclusion, that they're working on that. It seems that access would be a big part of that, and that's something you work to facilitate. Do you have any specific thoughts there?
Yeah, I mean, clearly, I think the most obvious thing is telehealth has really gone a long way to ensuring that people are more included and have access to care. But there are other things that you need to do to make sure that your websites are certified and compliant along those lines. And I think that, most organizations are doing a good job on all of those fronts at this point in time. And if there was anything positive that came out of the pandemic, perhaps that's the one silver lining.
All right.
Scott, I would also add, well, first of all, we're not a Kyruus customer, but I did have Kyruus when I was in my last life at Bay State. And so I know a lot about your technology, but with regards to equity and inclusion, your capabilities could house the characteristics of clinicians who have, different languages that they speak, their ethnicity, et cetera. And so that matters to many patients who may be more comfortable seeing somebody who is like them. And so that also helps, our access representatives to find those specific individuals much more seamlessly. So to Rob's point, that's a great sort of, dual benefit, right? You get the patients what they're looking for, and then the access center folks have a much easier time finding those unique characteristics of providers who might be out in the community.
I completely agree with you, Joel. Completely agree.
All right, very good. Next question, we're going to start with you, Dr. Bart. How are you assessing ROI on digital initiatives today, and how has that changed compared to previous years? What do you need to see in an ROI narrative to believe it is compelling and convincing? As personnel costs factor heavily into ROI, how has your calculus or thought process around staffing and human capital changed or not in the past few years? And think of an initiative that is very important, but for which demonstrating ROI is extremely difficult. What would you do to make the case to continue with the project? Wherever you want to jump in there, whatever you find most compelling.
Yeah, I alluded to this at the top question, but I think we're paying much more attention to total cost of ownership of solutions. And I think in the past, we might have been solely focused on this makes the doctors and APPs more efficient. This makes the nurses more efficient. This makes the consumer patient experience a lot better. And we don't have the ability and the finances to be able to pay attention to that as just the sole success criteria anymore. We have to actually factor in putting in the new technology. Does it make our employees more efficient and more effective? We really have to account for that these days. And we have to document it very, very well. The days where I could put something in that was a shiny object that the consumers loved, but I also had to add 10, 20, or 50 FTEs to make it run on the back end. Those they're not around anymore. We don't have that luxury. We have to actually be thinking about, yes, we can create and improve that patient consumer experience while improving the clinical operational experience and the number of FTEs that it takes to support that endeavor. Hopefully it's either the same as when we were before, but ideally we're even able to decrease the operational salary support that's required for the new technology that we put in. I use the example of our central call center, which has a large number of FTEs involved in it. And as we look at trying to move more and more of our patients to a digital self-service scheduling model, that scheduling model has to be digital from the patient consumer initiation to the end where it actually lands the scheduled appointment. We don't want any manual steps in there, so that we are actually decreasing the footprint of the number of employees needed in that process of getting a scheduled appointment. To what Scott said earlier also, we will always need a call center at UPMC. There will always be circumstances and situations that need to be facilitated by an agent with an interaction. But for those who can be facilitated without needing an agent, we need to make sure that we can interact, help them find what they need, and land that appointment scheduled on a calendar without any human interaction other than the patient or the consumer initiating, yes, I need this service tomorrow. And that's really an area where we're trying to focus on the total cost of ownership. And we're really trying to document the impact of that once the project progresses and goes live, so that when we look back 5 or 10 years from now, people will say the reason we're spending this money here is because it had this type of value and impact to the organization, as opposed to just looking at the contracted costs and saying, oh, we could save this. And then 3 years after you end that contract, you go through yeah, but we had to add 150 FTEs when we ended that contract. That's what we don't want to have to go back through those processes again. And I think we're doing a lot better job at really understanding what the total cost of ownership and or the total impact that some of this digital transition is having on the organization.
Joel, is this something you're doing too? I think you alluded to it. What I'm thinking here, and we'll go back to Dr. Bart in a few minutes. What I'm thinking here is a deep dive into TCO for a particular application is a fairly complicated, time-consuming, and skill-intensive thing. I mean, I don't think this. Do you have the talent, so to speak, skill set in-house? Do you have to bring in outside people? Because I could see so much of the resources of the IT department being taken up in ascertaining whether or not the things they have rolled out at the request of the businesses are actually being used. I mean, are you shadowing nurses to see what they're clicking on and things like that? It sounds like a big deal.
Yeah, so you're absolutely right, and this is where IT and finance have traditionally, I think, played. And to your point and Dr. Bart's point, the resource it's resource intensive to a certain degree. We actually start with a pro forma, right, before we even get to the TCO. So first you got to make a business case. And I don't want to bore everybody on the call. I'm sure they all know that they have to do that, and we try to do that because ultimately you want to be able to articulate at the end of the day what the value of this project or program was to begin. And oftentimes we forget actually what it is that we're trying to achieve. We just start to look at the finish line and we cross it over, and everybody sort of congratulates everybody else after you've crossed the finish line. But really, what did you get out of it? And so, I think for us, it's always about, what's the North Star, what is the, in our case, what's the vision of the organization, and let's sort of work backwards from there. If we're focused on, personalized coordinated care, the first question is, this request of a digital capability or this project or program, does it map to that vision? If it maps to that vision, then what is it that you're trying to achieve to really sort of get to that vision? And the question, I think, to Dr. Bart's point is, what's the experience you're trying to achieve, and or what's the outcome? And maybe it's sort of both, right? It's you want a highly satisfied patient, and you also want to be able to improve access. And then from there, you think about what are the operational changes that you have to make? Because I think in the past I believe we often I think perceived in sort of deploying a technology meant that everything was going to get better, which is a complete farce, right? We all know that it's all about people, process, technology, or what I like to say is outcome, experience, operational change, and then wrap the digital around it. Because ultimately, if you want a different outcome, you want a different experience, there's got to be some operational change that occurs. And so then, once you've realized, sort of what you need to do operationally, then you can start to bring in and infuse the technology. But, that to me then creates the pathway towards ensuring that you're able to measure the value and the outcome and whatever other metrics you want to say are part of the success. As well as monitor and identify, to your point, if a nurse has to change their workflow in their process, did they do that? Did they adopt it? First of all, did they do all of the right things? Is it cumbersome? Is it easy? And so I think if you follow those processes, the technology almost sort of is in the background, which it should always be in the background. And everything else are the things that you really sort of, pay attention to. You pay attention to the metrics for success, and you pay attention to the adoption and processes that have changed that ensure that you're going to achieve those outcomes. So that's how we see it. And to your point, I think it takes the whole organization to be able to know how to create the pro forma, create the TCO and measure the TCO so that you can have that ROI achievable. I'd also like to add, in terms of the question here, how do you sort of look at personnel as a result of this sort of focus on digital initiatives and ROI? I would say to you that as we look at a more digital enabled workforce, to Dr. Bart's point, we also have to pay attention to upskilling the staff, right? Giving them technology isn't going to create efficiency. At some level, you have to educate them on the capabilities that they now have in front of them, whether it's a set of data or it's a set of digital tools, or maybe it's, like I said before, it's a new process or processes. And so, we are thinking about digital as a way to enhance the way that people work, which could mean, we don't need two more bodies, but it could also mean that one body is just doing, I'd say, more highly skilled work with the efficiency of a technological partner or a digital partner. So that's how, hopefully that answers the question. I love your questions, by the way. They're just so packed with so much meat. It's hard to figure out where I want to start. It's like a big sandwich that, I just want to take a bite out of every corner.
And on the East Coast, it is about lunchtime. So
hey, Anthony, can I just add one more comment to Joel? I
Sure.
agree with everything that Joel said, but one of the things that just popped into my mind as he was talking, that partnership between IT and finance, I think, has gotten better over my career in healthcare IT. And to the point now, we actually at UPMC have a new role. So the person who worked for our CFO, who was monitoring our IT budget, became so interested in what we do within IT that we created a new role for him in technology business management. And so to what Joel's talking about, he actually this is an individual who formerly reported to our CFO, who has the trust of our finance pillar, right? But is now working with in IT to get that sort of, what is the actual value to the organization that this investment is providing? And so that's really, I think, his new role sort of crystallizes what we're really trying to achieve here at UPMC as we look at new technology.
So Scott, you sell a tool that theoretically delivers value, which I think Dr. Bart thinks it does, and Joel worked with it before. So question to you is, what are your thoughts around if you were giving advice to CIOs and the like about determining value? It seems to be a huge theme on this discussion. What would your advice be about how to determine whether or not you're getting value out of a tool you've purchased?
Yeah, I like everything about your question, Anthony, except the theoretical part.
I didn't
I
want
was going to say the same thing, theoretically valuable.
I'm supposed to be neutral. I'm a neutral
Okay.
third party here.
That's all right. That's all right. So look, we deal with customers, clients all the time who come to us and think about, the common question is build versus buy. And so they like to think like, I could build a provider data management tool that could solve my problems. And I think oftentimes we point them to other experts in the field who have tried to do it and have failed, because it's a lot harder than you think it is. The complexity of bringing in data from credentialing, marketing, your EHR, your other provider management solutions with your affiliates, your HR databases, your ratings and reviews. There's a lot of complexity to A, capturing all that information, B, understanding which data element the source should be for that golden record of the provider. And then once you've even gone through that step, the cost of maintaining it. And so I encourage people to think about best in breed. Health systems have a lot to do, and maybe developing every aspect of their software that they need isn't exactly where they should spend their time, money, and resources. And so they have to think about, like, where do you truly want to be an expert and own something versus where do you want to be using a best in breed solution. And so I encourage them to think about that and understand their own dynamics inside of their organization first before they go out and start making decisions around a build versus buy, whatever the software may be, whether that's Kyruus, whether that's, nobody ever think about building in their own EHR. And so there's lots of different components of that.
Yeah, so that could, Dr. Bart, that could be, part of that TCO discussion is someone could look back and say, well, or someone could say, this would be cheaper if we just build it, but it could be a little more complicated than that.
Absolutely, Anthony. That's actually something that we look at. I think UPMC is an innovative leader with technology, which means that we do have a number of programmers or programming groups that we're looking at building different niche solutions. We always look at the vended market first to see what's there. And if there isn't something there that meets the needs, then we consider building it. And the opposite is true. How we ended up with Kyruus, we had a homegrown find a doc solution. It was going to have to become replatformed. And one of the things that we looked at it, Joel talked about lifecycle management of solutions. Well, there's also data cycle management on a solution. And we look at our incumbent find a doc, which worked reasonably well, but the data cycle management was not very good on it. And as we started thinking through that and going through the value analysis of it, it made sense to look at there's a number of professional grade solutions out there. Kyruus was the one that fit us most specifically and the one that we chose. But I think that you need to make those reassessments, especially with homegrown solutions. If you developed it 5 or more years ago, there's a good possibility that there's an off-the-shelf solution in that space today. And that's something that we always go back. Should we re-platform, or should we actually go look for something off the shelf? In this case, we made an off-the-shelf decision.
And that might be hard, right? Joel, I don't know if you've been in a position of having to get away from a homegrown solution. There's a lot of emotions. People feel very connected to that and have invested in it.
Yeah, it's certainly a difficult decision, or for those that had invested in it for sure. But I think to Dr. Bart's point, what's compelling is ultimately when you look at the experience and again the outcome that you're trying to achieve, and then of course this notion of maintenance and management over time, whether it's the data or the technology itself. Tends to be a good reminder for particular users that there's a lot of effort and potentially fallibility in having your own homegrown system. Now you can customize it for sure, but how many times have we broken things when we had to reintegrate, et cetera? And so at some level, I think you remind them of that, and then they say, you know what, let's just standardize it, or let's just go with with an off-the-shelf solution and just kind of wash our hands with that stuff. So I think we're getting towards that more and more these days because of folks understanding and just experience with technology in general.
All right, we're gonna go to my favorite section, Ask a Co-Panelist. And I want to start with Dr. Bart. Dr. Bart, do you have a question for one or both of your co-panelists?
I would, I think for Joel, as we're also similarly positioned within Pennsylvania as your healthcare system is in your state. And how are you viewing keeping your healthcare system sort of at the digital forefront relative to the competition? Because there's two things you're trying to achieve, right? You're trying to achieve simplicity for the patient or consumer, but also you're trying to distance yourself from the competitors. And we haven't talked about too much about distancing from competitors, and I'd be very interested in sort of your viewpoint on that.
Yeah, it's it is the balance that we have to strike, and we're sort of arguably and quite honestly we're just at the sort of the beginning of our digital journey, and so the way that I look at it is that if we make it, if we truly achieve our vision of personalized coordinated care, which I love saying because it just, to me, it's just so accessible and tangible for what I need to do. If we can achieve that, that means that we reduce the friction of the engagement between our patient and the enterprise. And if I can do that with the technology that we offer them or the digital capability that we offer them, I think we win the game of or the competition at some level with not just those that are around us physically, but even those that are virtually our competitors, if you will. And if we can make it easy and seamless and personalized, then I think we'll continue to have loyalty, and or it becomes as what people like to say, sticky, and then we have sticky patrons or patients. And so we know that we have an access problem. I think that's an imperative for all health systems. So starting with that, how do you make it easy? How do you make it personalized? And so I think if I focus on that, and I focus on the design, the human-centered design aspects of that product or that capability, we outpace our competition, for sure. And that's sort of the simple principle that I have. I mean, I would love nothing more than to offer the prettiest looking, application or app, and the most highly functioning one. But if it doesn't meet the what I'd say the simple needs of the user are, then it doesn't matter how great it looks. We'll lose them to somebody else who has a more frictionless experience.
Yeah. I appreciate the thought on that.
Very good. Scott, do you have a question for one or both of your co-panelists?
I do. I would love to ask them both questions, but I know we're running up against the time. I'll start with Dr. Bart. So Dr. Bart, there's a lot of price transparency rules that are out there for the last year or so. And as UPMC is both a plan and a deliverer of care, I'm curious, have you started to think about how you use those price transparency rules in a kind of a strategic way to improve the overall member and patient experience that might differentiate you from some of the competition?
Yeah, so we have had some of those discussions, Scott. Just to be clear, there's a pretty significant corporate firewall between the payer side and the delivery side. Having said that, because these are going to be publicly facing, there's some conversation. I think we're trying to understand from a legal perspective how coordinated that conversation can be between the member side and the patient side. To be quite honest, I think that the transparency on the member side is, to me, seems to be a bit more straightforward.
Mm-hmm.
And that one, I think, is moving along at a much faster pace. In Allegheny County, where Pittsburgh sits, and the surrounding 5 counties, about 50% of the patients who get care at a UPMC facility are also a member. And so in that concentrated market, making sure that we have some sort of alignment on what the payer side and what the delivery side is doing is important. The challenge on the delivery side, and I'm sure Joel struggles with this too, is that our charge description master, which is where a lot of this information on the delivery side comes from, it varies from each facility, because not each facility has the same cost footprint, right? Mm-hmm. We have big academic teaching hospitals, we have small near critical access hospitals, and we have some, medium to large community hospitals. And trying to work through sort of translating that into consumable information that's actually useful for a patient or a consumer trying to make a financial decision or to incorporate finances into their care decision, it honestly has been a bit challenging. I think we're getting better at it, but I think that the industry, UPMC, as well as the industry, has a long ways to go. And I think fulfilling beyond the letter of what that requirement was trying to achieve. Because I think what we're trying to do, right, is to get, I know that there's a really good doctor who does this procedure at this facility, but what is the cost or value of that, including incorporating the financial piece relative to another doctor at another facility who seems to have similar outcomes that are publicly reported. I think the industry is not quite at that point, but I think we're moving in that direction, and it will be something that consumers having more and more choice of where to get care. I think it will be a factor in them determining where they go to. So there's a combination of decreasing the friction, as Joel said, but then it's also increasing the consumability and access to the true cost of care to them. That's got to be achieved.
Yeah, I agree. Thank you for that thoughtful response.
All right, well, we're almost out of time. Scott, I want to give you one opportunity to give a final thought for our audience today, something to take away, a little piece of advice for some of the things we discussed.
Well, thank you, Anthony. And again, Joel, Dr. Bart, thank you very much for spending the hour with us. I hope our audience was able to glean something from your thoughtful and insightful responses to the excellent questions that Anthony and team put forward. I think that if I could leave one parting word for the audience, it is that as you're embarking on your digital patient access journeys, clearly you need to be considering both what the member or patient experience will be, along with what the operational impact will be as well. And make sure you're addressing both sides of the coin, because if you try to go after one or the other, you're probably going to fail in our economic environments today.
Excellent. Well, that's about all we had time for today. Regarding continuing education, you could use the final slide in this deck. You'll get an email when the on-demand recording of this event is ready for viewing. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming webinars. With that, I want to thank our tremendous panel, Dr. Rob Bart, Joel Vengco, Scott Andrews, and Kyruus for sponsoring, and you for attending. With that, everybody have a wonderful day. Thank you.
Thank you.
Thanks so much.